Let's turn to video 10, Assessing and Treating Jane. This is a case history. Jane, not her real name, is a 17-year-old girl who first presented to our program for evaluation with a chief complaint of recurrent thoughts and fears of her mother dying, as well as fears of germs and dying herself. She exhibited repetitive hand washing and needed to touch things over and over. The number 5 also carried special significance. She routinely touched things 5 times to neutralize her anxiety and the unpleasant feelings. Although these symptoms had been present since early childhood and had been expressed daily for a long time, there was a major exacerbation in her symptoms after she was told by a dental hygienist that she would die if she did not floss her teeth properly because of her history of mitral valve prolapse and the possibility of bacteria getting into her bloodstream. While Jane was able to maintain some control of these thoughts at school, this was becoming more and more difficult, and she would often totally lose control while at home. Because of the severity of these symptoms, she rated her mood as a 3 on a scale of 1 to 10, with 1 being worst and 10 being best. She admitted to feeling down more often than not, although she denied suicidal ideation. She denied problems with sleep. There was no loss of interest in activities of hobbies, and her appetite remained good. She enjoyed school and her grades had remained good. Although Jane was able to maintain stable friendships, she was unable to spend the night at a friend's home because her worries increased dramatically when she was away from home at night. She was diagnosed with obsessive-compulsive disorder. The Children's Yale-Brown Obsessive-Compulsive Disorder Scale, SIBOX rating was 28. The scale ranges from 0 to 40, with scores over 12 being considered clinically significant and scores of 20 and above representing significant dysfunction. Jane had seen a counselor previously but had received no medication for her symptoms. This had not resulted in relief of her symptoms. A combination of CBT and fluoxetine started at 10 milligrams per day and gradually titrated to 60 milligrams per day was implemented. After a recent increase in symptoms and failure of CBT booster sessions to adequately reduce her OCD symptoms, her fluoxetine dose was gradually titrated to 80 milligrams per day, which resulted in her most recent SIBOX score of 13. Key points. The course of illness described above where subclinical symptoms are followed by triggering event which causes an exacerbation of symptoms is characteristic of the onset of many OCD cases. Combination of CBT and SSRI treatment was optimized using a titration approach over the course of 7 weeks. She reached an optimal dose that led to a dramatic decrease in symptom severity and symptom remission. After relapse in her OCD symptoms and after failure of CBT booster sessions to ameliorate her symptoms, her SSRI dose was again gradually titrated to an optimal level that led to remission of her OCD symptoms.